Nurse Lainey here. Come with me as I take care of a patient with Impella and CRRT. So, what is Impella? Impella is a small device they place inside the patient's heart to help the heart pump the blood all over the body. And what is CRRT? It stands for Continuous Renal Replacement Therapy. It is basically a slow paced dialysis to help the patient cleanse their blood whenever the kidney fails to function. So, what do we do as a nurse? Every hour, we have to assess the impella site for bleeding and leakage. Every hour, we do pulse checks, especially on the limb where the impella site is. Every hour, we have to measure patient's intake and output. Every hour, we have to chart the vital signs and impella console numbers. And then we have to do calculations for the CRRT removal. Every 2 hours, we have to check for our ACT or activated clotting time. This is to make sure the patient's blood is not too thin or not too thick. And every 4 hours, we have to shoot numbers from our Swan GANs to make sure we get our hemodynamics. We have to check our arterial blood gas. We have to check our venous blood gas. We have to check our blood sugars. We have to draw blood to make sure our electrolytes are stable and replace it as needed. And we have to check our blood count to make sure the patient doesn't need any blood and transfuse as needed. And beside from all these tasks, we have to make sure the patient continues to be alive while on these critical machines and critical drips. And this is what we do for the entire 12-hour shift. Hope you enjoy this post and bye!